Fitzgerald. I am the very new Director of the Office of Public Health Preparedness at the Boston Public Health Commission. I just started a couple of weeks ago, so still learning lots of things. It's wonderful to be here among colleagues, partners, community champions who are united by a simple but powerful idea, that the path to climate resilience runs directly through the health and well-being of people. I stepped into this role just over a month ago. In that short time, I've had the opportunity to work with many of you, public health organizations, healthcare systems, community organizations, emergency management, leaders and residents who all understand that climate change is not just an environmental issue, it's a public health crisis. It's unfolding in real time and disproportionately impacting those already carrying the heaviest burdens. The health, social, and economic impacts of climate change are not felt equally, disproportionately harming vulnerable populations like children, seniors, those with chronic illnesses, and accessing functional needs, and marginalized communities. Systemic racism and discrimination exacerbate those impacts, making certain communities more vulnerable to climate-related health hazards. The response I almost always get when I tell people about this job is, wow, interesting time for that. They're not wrong. To put it conservatively, public health and preparedness have had a challenging couple of years. And as the current administration continues to promote fossil fuels, roll back regulations to undercut climate resilience efforts, and threaten public health and even basic science, it's clear that we can't count on federal support. To become resilient, we must build trust and be able to rely on each other, those of us in the group. Here's just some of what we know. Rising temperatures lead to increased incidence of heat stroke, cardiovascular and respiratory problems, and negatively affect mental health. Climate change exacerbates air pollution, which is linked to asthma, lung disease, and premature death. Deforestation and changing weather patterns expand the range of disease-carrying insects like mosquitoes, leading to increased incidence of West Nile, Lyme disease, and a few. And then climate-related disasters and long-term environmental changes also contribute to trauma, stress, anxiety, depression, and PTSD. Droughts, floods, extreme weather can not only produce massive physical damage, but disrupt food production, contaminate water supplies, leading to malnutrition and waterborne diseases. We've seen more frequent and severe disasters such as hurricanes and wildfires across the country in the last few years. Tornado Alley is shifting east, and the effects aren't singular. In North Carolina, Hurricane Helene caused widespread and devastating flooding, landslides in the western parts of the state that weren't typically considered to be that prone to disasters. In Boston, we're seeing the effects of flips with record-breaking heat waves, inland flooding, coastal storms, and air quality emergencies that are driven by wildfire smoke thousands of miles away. These aren't one events. They're compounding shocks, chipping away at the foundation of community health. And that's why our work must be grounded in partnership and people. As Leon said, while the climate crisis is global, the response must be local, personal, and immediate. Community organizations create resilience from the ground up. Neighborhood-based groups are not just stakeholders, but leaders. They know which residents need backup power for medical devices. They know which neighborhoods and buildings trap heat. They know how to reach seniors who don't have internet access during an emergency. Their knowledge and their trust are non-negotiable assets. We need to ensure that climate change and health data are action-focused, so not just mapping floodplains, but mapping vulnerability, chronic illness, housing insecurity, language barriers, because resilience isn't just about weathering the storm, it's about who has the ability to recover. This work isn't easy. It's a complex and cross-sectoral, and it requires sustained commitment to a shared agenda of climate justice. We must build trust and be able to rely on each other. That's why we're all here. Because we know that when equipped with the right resources and a seat at the table, our communities already hold many of the solutions to the problem that we're facing. Thank you for being here and for showing us, and I mean Boston, state, and honestly the country,